Every locale throughout the United States is at risk for natural disasters, severe weather, and other types of destructive events that have the potential to cause widespread human and material losses, displace populations, and disrupt critical infrastructure. The devastation wrought by Hurricanes Katrina and Sandy are just two examples of catastrophic events that resulted in large-scale population displacements. When an event like this occurs, public health plays a key role in ensuring the health and safety of displaced persons. Hello, I'm TRACEY MATISAK for the Medical Reserve Corps, or MRC. You are watching this video because you are interested in assisting with a mass care response in Pennsylvania. In order to serve our population, we will need strong volunteer support. We thank you for your willingness to volunteer. As a volunteer, you may be asked to support a mass care response. This video focuses specifically on a sheltering response, which is the most common type of mass care response. Evacuation shelters provide temporary shelter, feeding, and other support services for people who have been displaced from their homes. This video will review several main concepts about mass care services and give you the information you need to respond appropriately and safely. The main topics you will learn about in this video include an introduction to evacuation shelters, including typical agency responsibilities and general operating procedures, the roles MRC volunteers could be asked to perform when working in a shelter, an overview of caring for medical needs and at-risk populations in the shelter setting, and debriefing and demobilization after your volunteer service. An evacuation shelter is a place where hundreds or potentially thousands of people might go following an event that causes a large-scale displacement. The goal of the shelter is to keep people safe and to temporarily provide for their needs until they can either return to their homes or make alternative housing arrangements. When working in a shelter, please remember to maintain confidentiality about the shelter residents. Who they are, where they live, and any medical conditions they may have is private information. Shelters may be open for a few days or a few weeks, depending on the severity of the event. Most shelters are a multi-agency effort with services provided by both government and non-governmental agencies such as the American Red Cross and Salvation Army. While the organizational structure and agency responsibilities may vary across counties in Pennsylvania, the core functions are the same. Shelters are typically set up in school buildings that have large gymnasiums, recreational centers, or other facilities that have large open spaces. The main sections of a shelter may include registration, a dormitory, a feeding area, a medical clinic or first aid station, a quiet or low-stress area, and a children's play area. MRC volunteers may serve in a variety of roles in a shelter depending on the jurisdiction the shelter is in and the scope of the response. Shelter roles for MRC volunteers may include medical or non-medical roles depending on the jurisdiction. Medical roles may include working at a medical field clinic or first aid station to provide clinical services to people staying in the shelter. Medical services could include activities such as patient assessment, assistance with management of chronic conditions and medications, blood pressure checks, blood sugar checks, or basic wound care. The medical field services that are provided may vary across counties. You will receive further instructions from your unit coordinator regarding scope of service. Only volunteers with the appropriate clinical credentials can provide medical field services. In some shelters, MRC volunteers may serve in non-medical roles as well. Providing psychological first aid is important. When shelter residents are experiencing mental health issues, the shelter management team will attempt to connect them with a behavioral health professional, but MRC volunteers may be asked to provide basic psychological first aid in the meantime. For example, MRC volunteers may assist at the registration station, helping people to get checked in and assigned to dormitory space. Sometimes volunteers may assist with tasks of daily living, such as assistance with getting to the bathroom. MRC volunteers may also assist in providing logistical support, such as setting up cots, handing out blankets, or similar duties. These roles do not require clinical qualifications. The shelter manager is responsible for overall operations and will assign non-medical duties to volunteers as appropriate. MRC volunteers working at a shelter will be notified about their shift or shifts via the Serve PA system. Upon arrival at a shelter, volunteers should check in at staff registration. The first shift may be responsible for setting up a clinical station. MRC volunteers should work with the shelter management to designate an area for this station. Further instructions about non-medical roles and responsibilities will be provided at registration. If after your on-site training you still have questions about your role, please notify the shelter manager or your unit coordinator. There may be some variations in what this clinic looks like across the counties in Pennsylvania. The clinic area may have an area for supplies, an area for patients to wait, and an area for patient care. Volunteer safety is paramount. MRC volunteers will never be asked to put their own lives in danger and should not travel to a shelter if they have concerns about severe weather or about the safety of their own family members. If, while working at the shelter, a volunteer observes any activity that seems suspicious or threatening, it should be reported to the shelter manager immediately. Likewise, if the volunteer is injured or observes an injury to another person, this should be reported to the shelter manager immediately. Individuals staying at a shelter may be among the most vulnerable. They may have a variety of medical, access, and functional needs. For instance, some evacuees may have chronic medical conditions such as diabetes or hypertension, which may require daily check-ins at the medical field clinic to remain stable. Shelters may have a variety of equipment to support access and functional needs. For example, there may be a supply of durable medical equipment, such as wheelchairs and walkers, to assist evacuees who have mobility impairments. Different types of assistive technology may be available to help evacuees with visual impairments. Translation and interpretation services may also be available to assist with communication. MRC volunteers will support the public health response for the duration of the incident or for as long as their services are needed. Debriefing should occur after each shift. This will likely occur via a survey or conference call with the MRC coordinator. Depending on the incident, demobilization may include a mental and physical health assessment. We encourage volunteers to be aware of their physical and mental health needs while responding. Report any injuries or stressful situations as soon as possible to the on-site manager or unit coordinator. For demobilization, MRC volunteers should ensure the following: that all assigned activities are completed, if additional assistance is required, that all issued equipment and supplies are returned and accounted for, and that the volunteer checked out at the end of his or her shift before leaving the scene or site. At some point in the future, evacuation shelters will be opened in response to a severe weather event or similar disaster. We will need your help to support and care for displaced persons during this traumatic time in their lives. Thank you for investing your time and effort to help us be better prepared when the next major storm hits. And thanks for watching.